Imagine a world where the joys of parenthood are painted with the colors of love, the first cuddles, heartwarming smiles, and a rush of emotions. Have you ever felt the overwhelming rush of emotions that comes with becoming a parent? The joy, the love, the sheer wonder of holding your little one in your arms? But what if behind the smiles and happy moments, there's a struggle that often goes unnoticed? A battle that not everyone talks about openly? Join us on a journey through the highs and lows, the tears and the triumphs, as we uncover a story that showcases the strength of the human spirit. Stay with us till the end to discover the powerful lesson that Emily and Alex learned, a lesson that might just change the way you view parenthood forever. Emily couldn't believe her eyes. Parenthood forever. Emily couldn't believe her eyes as she held her precious baby in her arms for the first time. Their little bundle of joy wrapped in a soft pastel blanket was a sight to behold. The baby's tiny fingers gently wrapped around Emily's, creating an instant connection that filled her heart with overwhelming love, and the days that followed, Emily was on cloud nine. She marveled at the tiny features of her baby, the delicate nose, the soft cheeks, and the bright eyes that seemed to be exploring the world around them. Alex, her loving and supportive husband, was equally enamored by their new addition to the family. Everything seemed perfect. The nursery was a haven of tranquility, adorned with baby toys and a rocking chair where Emily would gently lull their little one to sleep. Friends and family visited, showering the new parents with warm wishes and gifts. But as the days turned into weeks, Emily started to notice something was amiss. She found herself feeling teary for no apparent reason. The simplest things, like a baby's giggle or a touching movie scene, brought tears streaming down her cheeks. At first she brushed it off as the baby blues, assuming it was a normal part of adjusting to motherhood. However, as the teary episodes persisted, Emily began to feel more than just emotional. She fell down, unable to find joy in the things that used to make her smile. The weight of sadness seemed to linger in her heart, overshadowing the happiness she should have been feeling with her newborn one day while Alex was rocking their baby to sleep. He noticed Emily sitting in the corner, her eyes filled with sadness, concern etched across his face. He gently approached her, asking if everything was all right. Emily tried to put on a brave face, but her emotions got the better of her and she burst into tears. She admitted to Alex how she had been feeling, the inexplicable sadness, the constant feeling of being overwhelmed, and the struggle to connect with their baby in the way she had imagined, without judgment or hesitation. Alex hugged Emily tightly, reassuring her that it was okay to feel this way and that they would get through it together. He gently suggested that they reach out for professional help to understand what Emily was experiencing. The next day, they scheduled an appointment with a healthcare professional specializing in postpartum mental health. After carefully listening to Emily's experiences, the doctor diagnosed her with postpartum depression, commonly known as neonatal depression. The diagnosis brought a mix of emotions for Emily. On one hand, she was relieved to have a name for what she was going through, knowing she wasn't alone. What is postpartum depression? Having a baby is a life-changing experience. Being a parent is exciting but can also be tiring and overwhelming. It's normal to have feelings of worry or doubt, especially if you are a first-time parent. However, if your feelings include extreme sadness or loneliness, severe mood swings, and frequent crying spells, you may have postpartum depression. Postpartum depression is a type of depression that happens after someone gives birth. Postpartum depression doesn't just affect the birthing person. It can affect surrogates and adoptive parents, too. People experience hormonal, physical, emotional, financial, and social changes after having a baby. These changes can cause symptoms of postpartum depression. If you have postpartum depression, know that you are not alone. It's not your fault, and that help is out there. Emily asked, "What are the types of postpartum depression?" There are 3 different types of postpartum mood disorders: postpartum blues or baby blues. The baby blues affect between 50% and 75% of people after delivery. If you're experiencing the baby blues, you will have frequent, prolonged bouts of crying for no apparent reason, sadness, and anxiety. The condition usually begins in the first week, 1 to 4 days, after delivery. Although the experience is unpleasant, the condition usually subsides within 2 weeks without treatment. The best thing you can do is find support and ask for help from friends, family, or your partner. Postpartum depression is a far more serious condition than the baby blues, affecting about 1 in 7 new parents. If you've had postpartum depression before, your risk increases to 30% each pregnancy. You may experience alternating highs and lows, frequent crying, irritability and fatigue, as well as feelings of guilt, anxiety and inability to care for your baby or yourself. Symptoms range from mild to severe and may appear within a week of delivery or gradually, even up to a year later. Although symptoms can last several months, treatment with psychotherapy or antidepressants is very effective. Postpartum psychosis is an extremely severe form of postpartum depression and requires emergency medical attention. This condition is relatively rare, affecting only 1 in 1,000 people after delivery. The symptoms generally occur quickly after delivery and are severe, lasting for a few weeks to several months. Symptoms include severe agitation, confusion, feelings of hopelessness and shame, insomnia, paranoia, delusions or hallucinations, hyperactivity, rapid speech or mania. Postpartum psychosis requires immediate medical attention since there's an increased risk of suicide and risk of harm to the baby. Treatment will usually include hospitalization, psychotherapy and medication. Who is affected by postpartum depression? Postpartum depression is common. As many as 75% of people experience baby blues after delivery. Up to 15% of these people will develop postpartum depression. 1 in 1,000 people develop postpartum psychosis. How do I know if I have baby blues or postpartum depression? Many people have baby blues after giving birth. Baby blues and postpartum depression have similar symptoms. However, symptoms of baby blues last about 10 days and are less intense. With postpartum depression, the symptoms last weeks or months, and the symptoms are more severe. You may have the baby blues if you have crying spells, feel overwhelmed, lose your appetite, have trouble sleeping, have sudden mood changes. How long does postpartum depression last? Postpartum depression can last until 1 year after your child is born. However, this doesn't mean you should feel cured in 1 year. Talk to your healthcare provider about your symptoms and treatment. Be honest about how you feel. Think carefully about if you feel better than you did at the beginning of your diagnosis. Emily asked, "Doctor, what factors increase my risk of being depressed after the birth of my child?" Certain factors increase your risk for postpartum depression: having a personal or family history of depression, postpartum depression, limited social support, marital or relationship conflict, pregnancy complications like health conditions, difficult delivery or premature birth. You're younger than 20 or a single parent, having a baby with special needs or a baby who cries a lot. What are the symptoms of postpartum depression? Some people feel ashamed about their symptoms or feel they are terrible parents for feeling the way they do. Be mindful, postpartum depression is extremely common. You're not the only person who feels this way, and it doesn't mean you're a bad person. You may have postpartum depression if you experience some of the following: feeling sad, worthless, hopeless, or guilty, worrying excessively or feeling on edge, loss of interest in hobbies or things you once enjoyed, changes in appetite or not eating, loss of energy and motivation, trouble sleeping or wanting to sleep all the time, crying for no reason or excessively, thoughts of suicide or wishing you were dead, lack of interest in your baby or feeling anxious around your baby, thoughts of hurting your baby or feeling like you don't want your baby. Alex asked, "Doctor, what causes postpartum depression?" More research is needed to determine the link between the rapid drop in hormones after delivery and depression. The levels of estrogen and progesterone increase tenfold during pregnancy but drop sharply after delivery. By 3 days postpartum, levels of these hormones drop back to pre-pregnancy levels. In addition to these chemical changes, the social and psychological changes associated with having a baby increase your risk of postpartum depression. Examples of these changes include physical changes to your body, lack of sleep, worries about parenting, or changes to your relationships. Can postpartum depression affect my baby? Yes, postpartum depression can affect your baby. Getting treatment is important for both you and your baby. Postpartum depression can affect your baby in the following ways. You have trouble bonding with your baby and don't establish a connection with them. Your child may have behavior or learning problems. You may skip appointments with your child's pediatrician. Your child may have feeding and sleeping issues. Your child may be at higher risk for obesity or developmental disorders. You may neglect your child's care or not recognize when they are ill. Alex asked, "Doctor, how is postpartum depression diagnosed?" There's not a specific test that diagnoses postpartum depression. We will order a blood test because postpartum depression can cause symptoms similar to many thyroid conditions. Remember, I am here to support you and make sure you are healthy, so be honest with them. There is no judgment, and you aren't alone in your feelings. Alex asked, "How do doctors screen for postpartum depression?" It can be hard to detect mild cases of postpartum depression. Healthcare providers rely heavily on your responses to their questions. If your provider feels you have signs of postpartum depression, they will recommend an appropriate treatment. Alex asked, "How is postpartum depression treated?" Postpartum depression is treated differently depending on the type and severity of your symptoms. Treatment options include anti-anxiety or antidepressant medicines, psychotherapy, talk therapy or cognitive behavioral therapy, and support group participation. If you are breastfeeding, don't assume that you can't take medicine for depression, anxiety. Talk to your doctor about your options. Your healthcare provider may prescribe antidepressants to manage symptoms of postpartum depression. Antidepressants help balance the chemicals in your brain that affect your mood. If you're breastfeeding, talk to your healthcare provider about the risks and benefits of taking an antidepressant. Medications can transfer to your baby through your milk. However, the transfer level is generally low, and many antidepressant medications are considered safe. Keep in mind that it takes at least 3 or 4 weeks for antidepressants to work. Talk to your healthcare provider before stopping the medication. Stopping your medication too soon can cause symptoms to return. What are ways to cope with postpartum depression? It's okay to feel overwhelmed. Parenting is full of ups and downs, and having a baby isn't easy. If you have depression, you don't have to suffer alone. Your healthcare provider can help find a treatment that works for you. Here are some things you can do to help cope with postpartum depression. Find someone to talk to, a therapist, friend, family member, or someone who will listen to you and help you. Join a support group for new parents. Try to eat healthily and find time for exercise. Take proper rest for yourself. Go out with friends or talk to them on the phone. Find time for self-care and doing things you enjoy, like reading or other hobbies.